Okay. Next is cephalosporins. Now, you can also take these to the bank. If they have CEF or CEPH, it's a cephalosporin. Enjoy it now because this is not going to last, okay? All right. Cephalosporins are beta-lactam antibiotics. What does that mean?
That they have the ring.
Okay, they've got a ring. They are bactericidal. What does that mean?
That means
they make the bacteria kill itself. Okay. So MOA, it binds to PDPs. We just talked about penicillin binding proteins, where the bacteria chases down penicillin and binds to it. So cephalosporins will go and chase those down, right? They also disrupt cell wall synthesis. So if you can't make a cell wall around the bacteria will die because it has nothing to hold itself together, right? Okay. And it activates autolysins. What does to lyse mean?
To break down.
To kill, right? And what does auto mean? So they make the bacteria kill itself. Okay. That's why it's called bactericidal, right?
Yeah.
All right. Whew, don't be mad at me, okay? Y'all have got 5 generations of cephalosporins. Now, in pharmacology, we had this our first time to talk about generations. Generations mean like first generation means we just created the antibiotic or we just created the drug because you'll see generations in a whole bunch of different drugs. First generation drugs were super crappy. We just like pushed something out of the market. It had all these different side effects and then we fixed it. Okay. So the higher the generation, typically either the stronger or the better the medication is. Okay. So once cephalosporins were created, they started out with first generation. So obviously that's the weakest one. So as these go higher, they get stronger and stronger.
Okay.
Does that make sense? All right. So first generation is a drug called Cefalexin. Now next to it, I put whether it's gram positive or gram negative, which one it works on. So Cefalexin is positive. And because it's weak, we can only use it as prophylaxis or for like superficial skin infections, like little bitty infections. Got it? Got it?
Yes.
Okay. All right. And then second generation, we've got cefoxitin and cefuroxime. These work on gram negative, which makes sense because we put out the first ones. They were positive. And we're like, hey, those work okay. How about we try a negative one? Okay. So we did negative. The only downside to the second generations was it does not work against Pseudomonas. What do y'all know about Pseudomonas? Nothing. All right. Pseudomonas is usually hospital acquired. And anytime you think of Pseudomonas, you want to think green and weepy. No matter where the Pseudomonas is, it's green and weeping. So if it's in a wound, green and weeping. If it's in your urine, okay, it's nasty. All right. Why is it shaking? Hold on. Okay. And then third generation. So third generation is Ceftriaxone and Cefotaxime. Both of these work on gram negative. And the thing that they like to test on about third generation is it penetrates the CSF. Remember, most drugs don't cross the blood-brain barrier. So if it does go across the CSF, then what disease can I treat? That's right. So those treat meningitis. That's very important to note. Okay. Then we go into fourth generation. We're like, hey, we did positive, we did negative. How about we do one that's positive and negative? Okay. And so these work against very strong hospital resistant infections. So these are heavy duty badasses, right? Then we go into fifth generation, which is called Ceftaroline. And that one works on also the big baddies. MRSA, big baddie, meningitis, big baddie. Do you understand? So these go from weak to strong. You with me?
What's with the question around meningitis?
Yeah, because every semester, hold on. All right, so you understand how the generations are going to work?
Yes.
Yes, and I gave y'all a rhyme. I'm not going to be able to remember it right off the top of my head, but let me see if I can find it to remember these. Please hold one moment. But this is a way that you can remember the like what drugs go in which generation. Are we ready?
Yes.
Okay. So each one is going to have a little piece of that name. So you might want to just like highlight the little piece of the name too. You know what I mean? Like, okay, here's the rhyme, or here's the go. Yeah, like Lexi had a pet fox. You see cefoxitin?
Yes.
So Lexi had a pet fox, and it's also Furox. So you can't really mess that up. Okay, but Lexi had a fox named Rox. You see Rox? It's right underneath it. Okay. She tried, T-R-I, she tried to tax her boyfriend. His name was Peem. Sorry, that's his name. Peem. And so he left her for Caroline. Y'all see? All right, so Lexi had a pet fox who rocks. She tried to tax her boyfriend Peem, so he left her for Caroline. You see that? No, that's okay. It's going to be on your Quizlets too. Okay. So I was just letting y'all know that that's available. Okay. Oh, and let me talk to you about the Quizlets really quickly. So I will have the admins add y'all to this class. Okay.
Oh, I have been. Somebody said like.
Yeah, who liked those? Lupita liked those. Some people like them. Some people are like, oh my God, I can't memorize all of those. So use them if they resonate with you and don't use them if they don't. But the Quizlets we will send y'all a link to.
But they have this one for the cephalosporins, like how it's the fox has seen dying tea there with me. How it's the fox took it had seen on a dime.
Oh, I see. And I think some of them resonate, but then you also have to memorize another set of things. You know what I mean? So sometimes it works for people. I feel like for Lupita, it works really well. And then other people, they're like, I don't like it. So use it if it works. If it doesn't, that's okay. All right. So drug of choice. Oh, sorry.
No, my friend.
All right. So drug of choice, of course, is going to depend on the generation. Each generation has a different thing that it treats, right?
Yeah.
Okay. There is no treatment of meningitis with first or second because they do not cross the blood-brain barrier or penetrate the CSF. Okay. Meningitis, usually you can treat it with third, fourth, and fifth. Definitely fourth and fifth. Yeah. All right. Side effects. Thrombophlebitis with IV administration. What is thrombophlebitis? What does thrombo mean? Okay. No. What is like a thrombus? What's a thrombus? A clot. So thrombo means phleb. Like what does a phlebotomist do? Okay. So phlebotomist is phleb is a vessel, and then itis, inflammation. So there's an inflammation in a vessel that also has a clot. Do y'all remember in like first? It would have been in probably first semester. Where they talked about a palpable cord-like vein. Yeah. So this is a very big testing concept. A palpable cord-like vein. So in how do I say this? Let's see. In drugs that are vesicants, you know what a vesicant is? Okay, write down all these words because y'all need to know. I assumed y'all knew all this. This should have been first semester. I feel like they didn't teach our shit first.
Like irritates the vein.
Yes. A vulva vesicant irritates the vulva vessel. It like burns the inside of the vessel. And so that will cause the vessel to get very hard and very painful. So if a patient's like, oh, my IV site hurts, what's the first thing you're going to do? You're going to go look at it, right? Yeah. Okay. First, we already talked about extravasation. Yeah. So I'm going to palpate it. Is it soft and flat, right? Or is it puffy? If it's puffy, it's probably an extravasation. Or extravasations feel cold to the touch and they're puffy and you can't flush. A thrombophlebitis, you'll go and palpate where it's at. It's soft and flat, but the vein feels like a phone charger underneath. You know, like those cords? It's a cord-like vein because it's burned the whole inside of the vein and now it's hard as a rock and it hurts. Now, what do you do with thrombophlebitis? What would you have to do? Yeah, you would stop the medication, take out the IV, put a warm compress on it, and then you have to start at another spot. Okay. So cephalosporins, if you give them IV, they can cause thrombophlebitis. So that means you need to watch that IV site very closely, right? Mm-hmm. Cephalosporins have a disulfiram-like reaction. What is disulfiram? This is a psych drug. Well, you probably haven't learned it yet. Yeah. All right. I'm going to tell y'all one time and y'all are going to need to know for all of pharm because you're going to see this all the time. So if y'all have a red flag sheet or something, I would recommend doing that for this class because I'm going to keep asking y'all the same things over and over again. If y'all don't know them, we get annoyed. So disulfiram is a drug. You'll also have this in psych. It's a drug that you give patients that are trying to stop drinking. And this is a mean drug. It's called a deterrent drug. Okay. You know what it means to deter somebody from something to stop them, right? Yeah. So if they're like, hey, I'm an alcoholic, but I don't want to drink anymore. So they give them this pill, disulfiram. And if that patient does drink, it makes them violently ill. Facial flushing, nausea, vomiting. They feel very faint. Like they feel very sick. Now, it's meant to deter them from drinking because they know, like, hey, if I drink, I'm going to feel like absolute garbage. Okay. But there are some drugs that if you drink and you take this drug, it will cause a disulfiram-like reaction. So if I put a patient on cephalosporin and then they go to Vegas for the weekend, they are not going to have a good weekend because when they drink alcohol with cephalosporins, they're going to have a massive disulfiram-like reaction. They're going to puke. They're going to have nausea, vomiting, which they probably would have had in Vegas anyway, but for a different reason. Know what I'm saying? Okay. All right. So if they're on cephalosporins and you have to tell them like, no alcohol, you're going to be feeling real bad. You understand? All right. Adverse effect, anaphylaxis. Lots of people are allergic to cephalosporins. Give me your big girl words for anaphylaxis. Wheezing, pruritus, urticaria, angioedema. Very good. Cephalosporins can very rarely, but they always test on this, very rarely can cause bleeding. because they can cause low vitamin K. So you just need to watch for like, extra bruising, things like that. Never seen it happen. Super duper rare. But of course, they always test on the super rare shit, right? In some patients, it can cause pseudomembranous colitis. What does pseudo mean? Fake. Membranous is like the membranes inside your gut. And then COL means COL, colon, and then itis, inflammation. So a massive inflammation of the gut. Now, diarrhea we said was normal with the antibiotics. Well, what's the number one question you want to ask somebody when they have diarrhea so you can know if it's serious or not serious? Is there blood or mucus in the stool? And if there's blood or mucus in the stool, then this could be pseudomembranous colitis, and I would need to report that. I would not report diarrhea. Okay. We know cephalosporins are eliminated by the kidneys. Just watch kidney function. They're not kidney toxic, but you just got to watch it, right? So you're going to watch for urticaria, pruritus, wheezing in case they have an allergy. Y'all know if there's a true anaphylaxis, the first thing you do is to give epi. Yeah. Okay. Monitor their PT. What's a PT? That's a bleeding time, right? Prothrombin time. So if the patient does have a increased PT, that's the time it takes for them to, clot, then we might need to give them a little bit of vitamin K. Okay. Do not give cephalosporins with anticoags or ASA. What is ASA? It's very common. Y'all have all taken it. You can get it over the counter. Every little old lady takes it. Aspirin. ASA is aspirin, acetylsalicylic acid. Okay, so if you see ASA from here on out, that's aspirin. Okay, that's its abbreviation. So why would you not want to give cephalosporins with anticoags or aspirin? They can cause bleeding, so you don't want to give aspirin or anticoags. Now, aspirin is not a blood thinner, but it is an antiplatelet aggregator, right? So it can cause them to bleed more. Watch their BUN and creatinine and make sure you decrease the dose in our renal patients, right? Because it's excreted through the kidneys. Watch that IV site. How come? Cephalosporins cause thrombophlebitis, right? So you're going to give it very slowly and you want to dilute it so that it doesn't burn the inside of their veins. Okay? No alcohol with cephalosporins. How come? Disulfiram-like reaction. It's better if you take cephalosporins with food because it does cause some stomach upset. Now, I'm not going to report regular diarrhea, but I would report severe diarrhea or bloody or mucousy stool. Yes? All right.